covering the Northern Bahamas. You're watching the Bahamas Tonight, Northern Edition.
Welcome back. 31 cadets are celebrating tonight after completing their training year in the Grand Bahama Health Services and Ministry of Health Nursing Cadet Program. The graduation ceremony held yesterday in the foyer of the Rand Memorial Hospital.
High school students on Grand Bahama completing the Nursing Cadets Program, an initiative designed to introduce students to the nursing profession and give them a jump start in preparing for future careers. The Cadets Program exposes students to the necessary theory information and provides them with practical training on the various wards. Hospital Administrator Sharon Williams encouraged the students to remember the values they learned during the program.
For it is that desire, the desire to serve, that drives all other desires and characteristics of nursing, such as the desire to learn, so as to serve, the desire to be excellent, which you alluded to, and that is also so that you may serve with excellence, the desire to achieve your goals in becoming a true nurse so that you can care for and serve the people of our country.
Past program coordinator and guest speaker Patricia Henschel expanding on the theme of nurses committed to excellence. She encouraged the cadets to take their roles seriously, to always treat patients with respect, and do the little things with care.
Florence Nightingale, pioneer in nursing, rightly stated using the 3 C's. Nurses must be caring. Nurses must be compassionate. Compassion is at the core of nursing. Nurses must be committed. In fact, when you cadets state the Nurses Pledge, which was formulated in 1893, you will repeat, "I will devote myself to the welfare of those committed to my care."
Makaya Bain completed the program, while Azaria Lowe will be continuing during the next year. Both cadets say they have learned valuable lessons about the profession.
Being on the wards is my favorite part of cadets. I could always remember finding my way into the pediatric ward to cheer up the patients. I've learned over the 3-year period that respect should always come first with being a nurse. Every time I deal with a patient, I have to remember that this person could be my family. I have to treat them with respect.
During my first year, I observed many procedures, watched nurses give patients the hope and faith that they needed. As much as I would love to go on, it is only my first year in the program, and I have learned that nurses are the most caring and compassionate people that you can ever come across, and I will indeed be here again next year.
Megan Shepard, ZNS Network News.
Counselor for Central Grand Bahama Frazette Gibson celebrating a major accomplishment for the Wellington-Pinder Heights subdivision. Counselor Gibson announcing that the first phase of the park is complete and residents as well as children in the community now have a beautiful space to enjoy.
We have already cleared the property and we have now put on the park package, and so we are just waiting on the remainder of the fill to be delivered before it is level off, and then we will continue with our basketball court and then also with our gazebo, and then in our next stage, probably in the next 3 years, you will see a center for after school activities so that students can come and be assisted with homework help.
Ashton Pinder lives in the area and he says his son is excited about playing on the park.
Very good for there because last week, as you know, Hunters had their park opening, so and the kids were walking way down there, so I guess it's good that it's in their own backyard.
And now it is time to ask the doctor.
As I mentioned, welcome. As I mentioned previously, each year we commemorate Lupus Awareness Month in May. On today's segment, I will answer Michelle's final question. Do people with lupus have to follow a special diet? Again, Michelle, thank you for all your great questions on lupus, and the short answer is yes. When the disease is active, also known as a lupus flare, there may be some dietary restrictions. The doctor, along with the dietitian, will determine the best diet. If someone develops kidney disease as a result of lupus, this is what we call lupus nephritis, they may need to eat less protein. This is because most persons with lupus nephritis have protein in their urine, which in large amounts can cause further kidney damage. If high blood pressure is a factor, persons should not only eat a low-salt diet, but should take their blood pressure medications as prescribed by their doctor, because poorly controlled blood pressure in someone with lupus will not only cause further damage to the kidneys, but to the heart as well. If being overweight is an issue, weight loss can also help with achieving better blood pressure control, but it's important to speak with your doctor before starting any exercise program. I'm Dr. Monique Pratt, and this has been Ask the Doctor.